Hello everyone, this is Dr Abhishek Banerjee from the Department of Oral Medicine and Radiology, Senior Lecturer from BBDCODS. And I am here to discuss a lecture on pigmented lesions of oral cavity. In the course of disease, the oral mucosa tissue can assume a variety of discolorations like brown, black, or blue, which constitute the pigmented lesions of the oral mucosa. And such color changes can be attributed to the deposition of either endogenous or exogenous pigmentations. Oral pigmentations could be pathologic or physiologic. Pathologic pigmentation can be classified into exogenous and endogenous. Exogenous pigmentations come from outside in the body and gets implanted into the oral mucosa. Example being drugs, smoking, amalgam tattoo. Endogenous pigment are synthesized within the body itself. Example being melanin, hemoglobin, hemosiderin, or carotene. Hemoglobin imparts a red or blue appearance to the mucosa and represents pigmentation associated with vascular lesions. Hemosiderin appears brown and is deposited as a consequence of blood exacerbation, which may occur as consequence of trauma or a defect in hemostatic mechanism. Now melanin. It is an endogenous non-hematogenous pigment. It is produced by melanocytes and in the basal layer of the epithelium and is transferred to the adjacent keratinocytes via membrane-bound organelles called the melanocytes. It is synthesized by the nevus cells, and depending on the location and amount of melanin in the tissues, melanin-induced pigmentation can be either black, brown, or gray in color. This is a melanin pigmentation in the lower lip. Classification of pigmentations: it can be either blue, purple, brown, and gray, black. It can be either focal, diffused, and multifocal. Second classification is on the basis of diffused or bilateral and focal. Purple, blue vascular lesions. Hemangioma. Hemangioma is a benign proliferation of the endothelial cells that line vascular channels. Onset is during infancy and it regresses as the patient ages. Classification: there are various types of hemangioma. It can be capillary, cavernous, angioblastic, racemose, diffuse systemic, metastasizing, nevus, and hereditary hemorrhagic telangiectasias. Etiology: it is often congenital in nature and follows a benign course. Early signs of is blanching, then finally leads to a red macule. Most common site occurrence is lips, tongue, and buccal mucosa. And for examination, we do dioscopy. Hemangioma in children: it is rapid growth during the neonatal period, occurring beyond the growth rate in infants. Differential diagnosis is mucocele, ranula, or the superficial cyst, varicosity, and aneurysm. And management is sclerosing technique, in which sclerosing agent is given intralesionally, and cryosurgery. Second is Kaposi sarcoma, and it is described by Mortis Kaposi in 1872. It is a multifocal angioproliferative neoplasm that primarily involves the skin in non-HIV infected person, and it is associated by factors associated as a human herpes virus type 6, cytomegalovirus, human immunodeficiency virus, etc. Clinical features being it can affect any age, but most common is 5th, 6th, and 7th decade of life, and it affects more the male. Appearances: tumor becomes as a multicentric neoplastic process that manifests as multiple red or purple macules, and in advanced stages, nodular on skins or mucosal areas. Progressive lesion tends to enlarge, become darker, and may form clusters of single nodules. Clinical presentation, it can be classical type, endemic type, heterogenic type, and age-related Kaposi sarcoma. Location is most commonly in palate, gingiva, or dorsum of tongue. Appearance is oral lesions occur as red to purple nodules and macule with mucosal ulceration in the mature stages. Symptoms is pain, dysphagia, difficulty with mastication, and bleeding. Palpation, lesion does not blanch with pressure. Differential diagnosis is hemangioma, purpura, nevi, and melanoma. Management is radiation therapy, surgical eradication, and systemic chemotherapy, and intralesional injections. For combination therapy is given for AIDS-related Kaposi sarcoma. Brown melanotic lesions. First is melanotic macule. Benign pigmented lesions of the oral cavity characterized by increase in melanin pigmentation along the basal layer of the epithelium and the lamina propria. Most common pigmentation to occur in the oral cavity of light-skinned individuals. Etiology is genetic, racial, and environmental factors. Clinical features in age is mostly seen in middle-aged adults and affecting more females than males. Most common sign is vermilion border of the lip. Color and appearance is well circumscribed flat area of pigmentation that may be brown, black, blue, or gray in color. Size is less than 1 centimeter in diameter. Shape, lesion are oval or irregular in outline. Differential diagnosis is amalgam tattoo, ecchymosis patch, focal melanosis, and melanoplakia. Management is surgical excision. Melanoma. It is also known as melanocarcinoma, malignant neoplasm, third most common cancer of the skin. It is neoplasm of the epidermal melanocytes. Growth phase, radial growth phase, initial phase, which is the initial phase of growth of tumor. Neoplastic process is confined to the epidermis. Then is vertical growth phase, in which the neoplastic cell populate the underlying dermis. Based on the clinical feature, it can be of pigmented, non-pigmented, pigmented macular, nodular, pigmented mixed, and non-pigmented mixed type. Clinicopathological. These are clinicopathological types: superficial spreading, nodular, lentigo, maligna, and acral lentiginous. Affects mostly patient within 40 to 70 years, and average is 55 years, and most commonly seen in men. Site most common is palate and maxillary gingiva. Superficial spreading melanoma. It is sharply outlined, slightly elevated pigmented patch. Lesion occur as tan, brown, black mixed lesion of the sun exposed skin. Common sites of origin are intercapsular areas of male and the back of legs of females. Nodular melanoma, clinically it appears as a darkly pigmented elevations on skin or mucous membrane. Invasion in nature from the start and metastasizes early, and it has a poor prognosis. Lentigomacular, it appears as a flat, irregular pigmented patch with an ill-defined margins. Acral lentiginous, it is a darkly pigmented, irregularly marginated macule which later develops a nodular invasive growth phase.